Ladies and gentlemen, I would like to summarize for you the meeting that I have just had with the bipartisan leaders, which began at 8 o'clock and was completed 2 hours later. I began the meeting by making this statement, which I think needs to be made to the nation. America's public enemy number one in the United States is drug abuse. In order to fight and defeat this enemy, it is necessary to wage a new all-out offensive. I have asked the Congress to provide the legislative authority and the funds to fuel this kind of an offensive.
And from there into the arms and the bloodstreams of thousands of addicts all over the nation, including perhaps your hometown.
First of all, we live in a drug-ridden or drug-saturated society where people are taught from infancy to use a wide variety of mind-altering drugs.
Some are petty criminals who will remain drug addicts all their lives. Many addicts come from teeming slum areas where human misery runs high.
In the middle of the 20th century in the United States of America, hundreds and hundreds of teenage boys and girls are becoming hopeless dope addicts every year. It's fantastic.
The year is 1920 and the United States has just entered a new era, Prohibition. These were also known as the dry years, which was when the manufacturing and consumption of alcohol was outlawed. At first, it was enforced by states and communities, but after winning Senate votes 46 out of 48, it became federal law, which set itself in stone in the Constitution as the 18th Amendment. With this arose the bootleggers and moonshine distillers. Americans were not simply willing to give up drinking, and they discovered new methods to obtain and consume alcohol. Illegal manufacturing and distribution grew significantly alongside speakeasies, which were bars or clubs hidden from the view of the public. This led to widespread criminal activity and the formation of gangs and organised crime in major cities. Most notably Al Capone, whose empire was built on the illegal sale of alcohol, which would inevitably lead to violence and bloodshed on the streets over control of their empires. By the end of the 20s, support for decriminalization skyrocketed, with groups such as the Association Against the Prohibition Amendment. From the conception of the idea of prohibition, fought against it, and in 1932 became officially incorporated. By 1933, the 21st Amendment was created by the FDR administration, which abolished prohibition, reversing the 18th. The prohibition era in the United States is a past example of the shortfalls of the war on drugs. In this story, we have a beginning and middle, and now it's time for the end.
Taught to the coming generation to make it their business to see that no such matter as this is ever again made the subject of federal constitutional law.
My name is Dr. Ard Campbell. I am a historian of Prohibition on the island of Ireland, specifically in Ulster between 1850 and 1914. So when most people think of Prohibition, they're going to think of bootleggers, moonshine, speakeasies, and the sort of collective image we all have of the Prohibition in America between 1920 and 1933. But rather than that being just this random experiment that America had conducted over those 13 years, that prohibition in America actually came after what was almost a century-long global campaign, or sort of Western campaign, to get prohibition in America, Canada, Ireland and Britain. But as a historian, I believe that it's displacement from this history of prohibition on the island of Ireland that is impacting our inability to deal with the modern day prohibition on drugs. We don't know that we have this long-standing history. And as a harm reductionist, I believed that a way to reduce harm would be to recenter that history, understand where we're at through understanding where we've came from, so that we can move forward in a way that moves past prohibition.
Laws against certain drugs have been in place globally for over 150 years, but the war on drugs as we know it today began in the United States in June 1971, when President Richard Nixon declared drug abuse public enemy number one. 2 years later, after delays, the Misuse of Drugs Act became fully operational in the United Kingdom, with more drugs being added in the later years. These policies we saw come into effect all around the globe had a disproportionate effect on low-income and minority communities around the United Kingdom, such as the Brixton riots in 1981. Violence, gangs and organised crime are fueled due to the decriminalisation of drugs, which has spiralled into a vicious circle we see to this day. The deregulation of manufacturing and sales has made drugs significantly more dangerous than ever before due to substances being added to increase profits, which has led to countless unintended overdoses as people are not taking what they think they are. A report by the United States Institute of Drugs Abuse claims that in 2020 there were 15,000 opioid-laced cocaine overdoses. Between 1986 and 2021, there have been more than 3 million criminal records given to people, consuming police resources and filling prisons to unprecedented levels. The imprisonment of addicts favours the punishment of people who are in need, opposed to their rehabilitation. The Home Office reported that £1.6 billion is spent per annum on drugs policing, whilst a mere £500 million is being spent on rehabilitation.
So America has a profound impact across the world on prohibition and the war on drugs between the First World War up until the late 90s, and this, if you think about it, is the period of wars in the 20th century. First World War, Second World War, Vietnam, Korea, all of that. The drug war is also in there as well, and that's really spearheaded by a man called Harry Anslinger. He was the head of American Prohibition, and when Prohibition is repealed, he becomes the head of the Federal Bureau of Narcotics. And he starts this really racist campaign against cannabis and other drugs coming from Mexico, and he tried to say that black people in America used them more than white people. None of that was true. It was all racist stigma, but it still helped him to develop his drug war. He's one of the first ones who then goes to the United Nations, starts to pressure in member states in order to follow America. And then we start to, in 1961 at the United Nations, America basically forces other countries in to follow them in their ban on cannabis and other narcotics. So the war on drugs has had a profound impact on society in Northern Ireland, but the war on drugs really steps up here after the Good Friday Agreement, and it has had dire consequences for the peace process and the young people in Northern Ireland for who that peace agreement was signed for. So 26 years later, we have more drugs than we ever had before. We have the highest drug-related deaths within the Good Friday Agreement generation, so 25 to 35-year-olds. We have the highest drug-related deaths in the UK in the 18 to 34 age range. We have a continuation of paramilitaries. We have more paramilitaries in some cases. We have an increasingly toxic drug supply, and we have young people being punished for both buying and selling drugs and being groomed into criminality.
The social impact of the war on drugs is undeniable. It is time for change, and there is a number of ways we can achieve this. One in particular, the most radical approach which countries have tried, is decriminalisation. The leading example of this is Portugal, which in 2001 they took the drastic leap and implemented decriminalisation of all drugs. Before this, Portugal had the worst rate of opioid use in the EU. In the years following this radical approach, the numbers steadily declined in relation to drug use, overdoses, deaths, and the transmission of diseases such as HIV through shared needles. The healthcare approach which the government took gave addicts a second chance and gave them the necessary resources to get help and get themselves free from addiction. With people not being sent to prisons, costs from criminal proceedings and prisons dropped, allowing them to reallocate that funding to healthcare, which offset the costs, allowing government to save money in the long term.
So I think decriminalisation needed to be brought into Northern Ireland tomorrow or yesterday, but again it's reserved to Westminster, so we can't do that ourselves here. Portugal was in 2001 where they decriminalised all drugs. They have decreased drug use, they have decreased drug death, and they've decreased drug-related harms such as bloodborne viruses. 2001 was 4 years after the Good Friday Agreement. What would Northern Ireland look like now if we had done that then? Would we be in this position where we have young people that the Good Friday Agreement was signed for over-criminalised and dying, or would we actually have a form of peace like we were promised? Prohibition hasn't worked, is not working, and is never going to work, so we need to change it so that we can keep people safer from these substances that they are just going to use. There will never be no demand, so we have to meet a more safe supply that also removes criminalisation from people's lives.
With the HIV epidemic, there was a push for providing safe, sterile needles to addicts to prevent the spread, but in recent years, supervised injecting facilities have been the focus. In Northern Ireland, decriminalisation doesn't seem like it will happen anytime soon, but if we push for change, introduce new schemes, and access to services for addicts, a difference can be made.
Hello, I'm John Walsh, Chief Executive of Belfast City Council. Drugs are an issue. They will not go away. They are here, and what we need to do is manage the issues that flow from them. And if you accept that that is a reality, then you need to ensure that you do what you can in order to ensure that those lives are not lost. So for me, the drug prevention facility seems to be a very obvious answer albeit that it flies in the face of some legislative constraints in terms of the Misuse of Drugs Act. Well, there's no formal timeline as such, but obviously given that every day that goes by you run the risk of another life being lost, then it is something that we want to act on fairly quickly. But obviously Belfast City Council can't do that alone.
It is important to look at all the examples to see what works and how we can implement such ideas into our culture to treat addiction as a health issue and give addicts the help they need. As it stands, the war on drugs is a criminal and political issue where only a few people have a say in how we treat addicts, and it is time we change this and truly help those in need.